Okay, good afternoon, everyone, and welcome to the January 7th Career and College Readiness Office Hours. My name is Ken Bradford, the Assistant Superintendent for the Office of Career and College Readiness. So we'll go ahead and get started today with our office hours. And just so you know, the way that we'll do it today is all questions, you can submit those through to the online chat feature. Those will come to me. And we're going to start today, when we kick off, we're going to start today talking about school reopening. That will be with our pathway initiatives in readiness support. That division here in the department is run by Meredith McGovern. Meredith is out on leave today, so I'm pinch hitting for her. So we'll have updates when we get to that section from Dr. Finger and Miss Kim Buckingham from Children's Hospital New Orleans. And then we'll take questions at the end. We'll have some updates around foundational skills. We'll introduce our newest employee on the team when we get to our quality diplomas updates. And then we'll have an update around our newest initiative. You may notice my background, the Fast Forward. We'll have an update around the Fast Forward, the department's newest initiative. So what we'll do is we'll go into the pathway initiatives and readiness support updates. We'll start with Dr. Finger. We'll go through all of these kind of Children's Hospital New Orleans, LDH updates, vaccinations, COVID. I'll pause and take questions, and then we'll allow our medical experts, they can disengage, and we'll go through the rest of the stuff with the Office of Career and College Readiness. So if you're on, Dr. Finger, what I'll do at this time is I'll pause and I'll turn it over to you and let you take us through these COVID vaccine updates.
Thank you, Ken, and happy 2021 to everyone on this call. It's good to see so many familiar names and a couple of faces. 2021 will be better than 2020, guaranteed. So in the week of December 16th, the state of Louisiana began its vaccine rollout to the sort of first tier, which included frontline healthcare professionals, as well as congregate living facilities, both patients and those team members who worked in them. Just this past week, we moved into the next tier, which is phase 1B and tier 1, which includes, as you see here, mostly people who are over the age of 70, and then some other people, including home health patients and team members, students of schools of allied health, other ambulatory or small healthcare practices that aren't necessarily affiliated primarily with the hospital, and people with end-stage kidney disease. The state of Louisiana has received 2 types of vaccines, Pfizer and Moderna, which are both given in 2 doses. The Pfizer dose is given in 2 doses that are separated by 21 days. The Moderna vaccine is given in 2 doses that are separated by 28 days. By and large, the Pfizer vaccine is being sent more to larger hospital systems, and the Moderna vaccine to smaller and even local pharmacies. And the reason is not because one is better than the other, but because the storage requirements are different. And in smaller locations, many of them do not have the storage capacity to adequately store the Pfizer and keep it fully effective. So local pharmacies in your area, and in addition to other hospitals and healthcare providers, almost certainly have these vaccines and might have started the community rollout this week. I know we here in New Orleans started it locally on Monday and Tuesday. Again, many sites do not have walk-ups. These are all things that are made by appointment, and they differ by locations across the state, but you can see Ken's included a link to participating pharmacies if you need them. Next slide. So I know I said this in the beginning, that sort of first tier of phase 1A was the hospital personnel, including both clinical and non-clinical, as well as those long-term care facility residents and staff, as well as a portion of first-line responders. What we're talking about now is that phase 1B population, which is nearly 650,000 people, the vast majority of whom are over the age of 70. And again, We've begun that rollout here. I think, keep in mind, it's a slow rollout, not just in New Orleans, but across the entire state, because everyone who's taking part in the rollout also has a day job. So most people are doing this in addition to everything else that we do normally in our professional lives. So I anticipate this is going to continue to ramp up with pace and process across the entire state. I can tell you, everyone who is involved in this, from the governor all the way on down, is very focused on not letting vaccines sit on shelves and getting them into people's arms. So I hope that the pace of this progress is going to continue over the next several weeks and months. Next slide. Now, this is the exciting slide for this group, because you guys and your team members are included in the next tier of phase 1B. And I want to thank the Department of Education for really advocating with the Board of Education, who was able to go to the Office of Public Health to advocate for K through 12 team members. And they were aggressive in this. And Superintendent Brumley really was aggressive in advocating for you guys. And I'm glad to see that school workers are included in this tier. I think it's very important. You should feel proud. When this next tier is going to happen is unclear. I anticipate it will not be for several more weeks. Every local school district should be working on who their partner in vaccine providing will be. There's, at this point in time, not a specific group of people who are going to go from school to school across the state to administer this. So I think a lot of those details need to be worked out, but I'm really happy to see that school personnel are included in this next tier again, which will, I anticipate, occur in several weeks and probably not sooner than that. Ken, I'll take a pause there and see if you have any other questions that you'd like me to address now, or questions that you've gotten over the last couple of weeks from team members across the state.
Yeah, sure. And I think our next slide, Dr. Finger, we'll just start there, and that is, if you could just give us a summary of what it means for a shortened quarantine guidance. And I know you had really helped put together these charts, and it was before the break, so I'm not sure if everyone was privy to that. So if you could give a brief overview of what that is, the quarantine guidance.
Yeah, absolutely, Ken. That's pretty easy, and I can do that even without the algorithm. So the guidelines for a known COVID positive individual are the same. That isolation period is the same. For someone who is declared a close contact, we all remember before Thanksgiving, that person was on full quarantine for a full 14 days after the last known close contact. The CDC came out with some additional guidelines with the intention of decreasing that quarantine based on some specific situations. Everyone can decrease the quarantine to 10 days without getting a test. And again, this is as long as those individuals remain completely asymptomatic. Between days 10 and 14, though, those people have to continue to wear masks and socially distance. So that's challenging in some of our lower early education locations where kids are not masked, and even in K through 2 in some locations across the state, because we did not require that. So most of those schools have opted to keep the quarantine at a full 14 days because they can't bring a 4-year-old or back to school and say, I need you to mask when the rest of the class isn't. There's an option to bring someone back after 7 days if they get a molecular test that's negative between days 5 and 7 during their quarantine period. Again, that's an option as long as they remain asymptomatic and they continue to wear a mask and follow social distancing guidelines through day 14. So some school districts or schools have decided not to adopt that and to stick to the 10 days because trying to figure out exactly what type of test and when they got it has been an operational challenge. So I just mentioned those now. And again, those are based on knowing what the burden of disease is in the local communities. I hesitate to use some of those now, given how high the prevalence is, not just here in New Orleans, but across the entire state of Louisiana. So take all of that into mind as we make these decisions.
Thank you. Yeah, I've had 3 questions come in, and if others have questions while Dr. Finger is with us at the beginning of our presentation today, please send them to me through the chat. First question, Dr. Finger, is temperature checks. Many schools have started going back to school this week, either full-time or on a hybrid model where the students are coming 2 or 3 days a week. And the question is, do they have to continue doing temperature checks now in the second semester of school?
Yeah, absolutely. That continues to be a requirement. I recognize that we don't pick up a ton of kids who have an undiagnosed fever at that entry point, but every kid we pick up is a huge benefit. So definitely, we're not going to get more lax in that part of our operation, Ken.
Okay. Second question, and I know we touched base on this briefly yesterday, but there are some teachers in the state that are teaching foreign language courses or world language courses, and they may be non-citizens. Would those individuals still be eligible for the phase 1B tier 2 vaccination timeline?
If they're team members of schools, the answer is yes.
Okay, thank you. And the last question we have that come in is around school nurses. And, you know, we've gotten quite a few questions about this, is can school nurses administer the vaccination? And I know when I talked to you about this yesterday, you were kind of outlining how that worked, and there probably wasn't in the near future a scenario where like a school-based health clinic was, you know, administering the vaccination. But can you talk about how that how the vaccine is rolling out, and then how a school nurse may or may not be playing a significant role in that moving forward?
Yeah, and I think, again, these are lots of moving parts, Ken. I appreciate the question and the enthusiasm from the school nurses to help in the participation. Right now, the allocation of the vaccines is being determined by the state in conjunction with local hospitals and regional medical directors. Thus far, they've identified sort of what we call vaccine providers. And I know here locally, it's not like private practices who are doing it. We're trying to centralize it because we knew that the storage capacities for these were going to be really challenging for small, even community providers. So I can certainly bring up the question of schools being part of that, but right now I can tell you here in the greater metropolitan area, they're not, just because of the logistics of the transport and storage of the actual vaccines is beyond what a local school would be able to handle.
Okay, thank you for that. That brings us to the end of the questions that we've had come in. I think what we'll do now, Dr. Singleton, is we'll go to the next slide, and we'll actually, well, we still have our Children's Hospital New Orleans partners on the phone. I'll ask Ms. Kimberly to come on and talk to us about the town hall updates that we had. And I think we've done 11 of these already, and I think we're moving into like the 12th one coming up on the 13th. So Kimberly, if you're on, can you please join us?
Hi, Ken. Thank you. Good afternoon, everyone. Yes, we are moving on to our 12th town hall, which just shows that our partnership's going strong and how fortunate we are to have this whole team to work together as a state on all of this. So we're so proud to be able to work together. Thank you. What we have on the screen here is just some updates on our upcoming town halls beginning in January and lasting through February. We are going to keep a bi-weekly cadence. And this is just a quick link that you can register on. It's a 2-second registration, and then it will automatically add to your calendar, and it will update on the calendar as well if there's any adjustments for whatever means. We'll continue to record these town halls as well. As usual, we'll go over COVID-19 guidance, implementing the guidelines realistically in the school environment, answering any questions that come up around vaccines or anything else in the meantime. So we'll look forward to continuing the dialogue there. Additionally, while I'm on, Ken, I might just mention, not to be a broken record, but just to remind everybody about resources that are continuously available to them for COVID-19 support. We do have our Children's Hospital New Orleans hotline. That's 504-837-7760. For COVID-19 guidance, you just have to press option 1. That is available 7 days a week, most hours out of the day. And then if you hit option 2, we do have video visits that are available 24/7 for pediatrics. And even as an adult, you can get access to our our video visits as well. Yeah, so thank you, Ken, and please don't hesitate to reach out to thrivekids@lcmchealth.org if you have any questions, suggestions, or needs. We're here to support you, and we appreciate the opportunity to do so.
Thank you, Kimberly. Dr. Finger, we've had one more question come in if you have time. And the question is there a specific list of providers that schools should be contacting when it comes time to administer vaccines for educators?
So it depends. There's not a list of providers. What I would encourage you to do is each school district should work with their local regional medical director to help identify the best local healthcare partner to help coordinate that as best as we can. I think what I have learned is that it's also going to be helpful to message your team members that not everyone will get it the first day that this tier is announced it can be received, and that it's going to take several weeks to even a couple of months to be able to reach everyone on that tier. So I think that's something to be said. The other thing I would tell you guys is any school team member right now who's over the age of 70, I would work to get them vaccinated now. They're eligible and should go and get it.
Thank you, Dr. Finger. I think that brings us to the end of our questions and our updates from our medical partners at Children's Hospital New Orleans. So at this time, we'll transition to our quality diplomas updates. The quality diplomas division here within the Department of Education. This is led by Ms. Jessica Valalunguo. And we want to announce to you today that we have a new staff member who is joining this team. That's Troy Barn. He came from St. James Parish School System, where he was leading several programs at their Human Capital Center. As part of our team, he's going to be implementing the NCCR programs. He has extensive background and knowledge about building industry partnerships as well as rolling out apprenticeship programs. So with that, want you to be able to put a name with a face. So we have Troy on here with us. Troy, if you don't mind, give us a couple of remarks.
Hi, once again, like Ken said, my name is Troy Bourne. I come from St. James Parish Schools, and I'm looking forward to working with each and every one of you on implementing career and technical education programs within your schools. Thank you, and I'm looking forward to working with you soon.
All right, thank you, Troy. And Troy, just so you know, you're getting some shout outs in the chat. Congratulations, Troy. Next is our office post-secondary readiness. This office is led by Miss Stephanie Markham. And what I wanted to share with you today is, and you'll notice my background, it's the newest initiative of the department. We've talked with both Bessie and our Board of Regents, our state boards. And what we are trying to accomplish with this is increase the number of high school students graduating with an associate's degree or graduating having participated and been fully immersed in a state high demand apprenticeship program during high school. So we're going to really go into detail about this initiative. And what I want to do today is just encourage you, our CTE supervisors, our curriculum supervisors, superintendents, please consider joining us Monday at 2 p.m. We're going to announce, we are going to announce, and we're going to share with you an opportunity for a $50,000 planning grant. We're going to award one planning grant within each region of the state. And the intent of the planning grant will be for all of the stakeholders in that region, the other school systems, the charter schools, the community and technical colleges, to come together and map out a plan for being able to offer an associate's degree program as well as perhaps a fully immersed internship program. So we really want you to come and listen to this opportunity. And again, you're going to hear a lot about this. It's called Fast Forward. And this will be the initiative, again, to increase both apprenticeship opportunities and attainment of associate degrees. So please join us Monday, January 11th at 2 p.m. Okay, what I'll do now is I will pause and I will take some questions, and between myself and our team, we'll answer those. And so again, I just want to emphasize to you how we're structured here in the Office of Career and College Readiness. So I'll go through. We have Dr. Ernice Singleton. She is our Chief of Staff. She's my co-host today. She is transitioning the slides for us. And then we have our Pathway Initiatives and Readiness Support Division. This is led by Meredith McGovern, who's normally leading these calls for us. She does all of the school reopening stuff, advanced placement, dual enrollment, IB, and CLEP. We have the Foundational Skills Division. This is led by Dr. Jarek Hornbeek. This is most work that takes place in the 9th and the 10th grade, transitional 9th grade, freshman academies. It's also here where we provide information to our counselors. We have counselor newsletter. We do the counselor liaisoning through this office, pupil progression plans, and direct student services. So that's Dr. Hornbeek with Foundational Skills. We have our Quality Diplomas division. That is led by Jessica Valalunguo. That's really all things CTE, Carl Perkins, U.S. Presidential Scholar. We also have the Supplemental Course Allocation, Course Choice Program within that division. And finally, our Post-Secondary Readiness division, which is led by Stephanie Markham, and that's pretty much everything like post-graduation. This is also where our Fast Forward work will reside, since it's so many close partnerships for the associate degree attainment. So I'll pause for a moment. I'll go in and I will take a look at the questions and see what we have that have come in. Okay, we have one question that has come in, and it's specific to the student requirement for taking the U.S. History EOC. And so what I'm going to recommend is, if you have questions about end of course exams and who has to take them and what's the timeline for those, etc., that you reach out directly to our assessment office, and that's assessment@la.gov. And as of now, the board is clear. There's no questions. We'll wait another minute or so, and then we'll bring closure to today's office hours. Okay, we have a question that has come in. Will there be an application for Jumpstart Summers? Yeah, we've had this question a couple of times come in this week, because it's usually around this time when we start talking about that. What funds Jumpstart Summers is for the unutilized supplemental course allocation dollars. Those are any that are unencumbered, are redistributed for school systems to use for Jumpstart Summers. Last year, there was not a redistribution of those funds. And so a school system could have offered on their own a Jumpstart Summers program. But right now that is still to be determined. We do not have all of the enrollment numbers in for the spring semester, spring 2021. So we do not know if there will be a redistribution at this time of the supplemental course allocation dollars. So we're still waiting to get those numbers in to see if that's something that we're going to be able to do this year. Okay, and that's the end of today's questions. So we're going to bring closure to today's office hours. I thank you for joining. I ask also that you please consider participating next Monday in our Fast Forward informational webinar and hear more information about the planning grant opportunities and the program as a whole. Thank you for joining today.